Whitmer is declaring racism a public health crisis in Michigan. The governor signing an executive order to have all state employees undergo implicit bias training. She also wants the state to make health equity a major goal. 7 Action News reporter Saima Chowdhury with more.
The governor making some straightforward remarks at today's press conference, at times being critical at the federal response to the pandemic. And she declared racism a public health issue, signing off on initiatives to tackle that problem.
This pandemic has confirmed and highlighted the deadly nature of these pre-existing inequities caused by systemic racism.
The topic of racial disparities continues to be on the forefront among state officials as the pandemic has shed a light on it when it comes to health. COVID-19 is 4 times more likely to take the life of a black Michigander than a white one. That's why the governor signed an executive directive declaring racism a public health crisis. With the directive, the state is creating the Black Leadership Advisory Council
To develop our policies and paths to opportunity for Black Michiganders.
It's a 16-person council taking on topics of not only health, but public policy and the economy.
A report from the University of Michigan actually found that nearly half of Black Detroiters and a third of Latino Detroiters say they have lost their jobs due to this pandemic.
The council will identify gaps in state law that create or perpetuate inequities, and it will serve as a resource for community groups. The governor is also making implicit bias training mandatory for all state employees, including herself.
This is not alleging that people are racist. It's recognizing that everyone has biases from where we grew up or how we were raised.
And the governor says she's keeping a close eye on the number of coronavirus cases in the next few weeks. She says she doesn't want to have to roll back on the state's reopening plan, but she may if the numbers don't decrease. I'm Saima Chowdhury for 7 Action News.
Saima, thank you.